thank you very much. Well, did you brush your dog's teeth this morning after you brushed your own? Well, maybe we should. Dr. Jerome Williams, we're going to talk about what that picture means in just a second, but Dr. Jerome Williams and Dr. Bert Gaddis are here today as we're talking about Pet Dental Health Month. Gentlemen, good morning.
Good morning.
And Jillian, good morning to you as well.
Yes.
So, Dr. Gaddis, we should brush our dog's teeth every day?
Yes. That's ideal.
Wow.
Now, use their own toothbrush. Don't use
don't share your toothbrush.
And preferably pet toothpaste.
Okay. Yeah, because why do you not use human toothpaste?
The detergents in our toothpaste that foam up can irritate their stomach if they swallow it. So we use a pet toothpaste that has some enzymatic action. Daily or every other day is almost as good because the plaque takes about 2 days to harden where it can't be brushed away.
Okay, so we've got some video, and Dr. Williams, you and Dr. Gaddis can talk over this. Dogs don't love it when you brush their teeth, but they're pretty good about it, right? They just kind of tolerate us.
Here
so what is this? What's happened to this dog?
This is before we clean the teeth, the staining in the back, and here we're using an ultrasonic scaler to scale the teeth.
Now, this dog's obviously been put to sleep.
They have to be under a general anesthesia to do it properly.
Okay.
And we were using hand instruments just like the dentist or dental hygienists will use, and here we are polishing the teeth. Afterwards.
Because it's gone on too long without being cleaned, so what was going on with the dog's mouth?
This dog had very, very mild gingivitis, primarily back in the back. The gums were starting to get red. There also was a little issue with the enamel on one tooth that we wanted to recheck. And
it's more than bad breath because we brush our dog's teeth, because once you start getting that, what happens?
Gingivitis is the first stage of periodontal disease, and if we clean the teeth before that advances, it reverses.
And periodontal disease is?
Periodontal disease is loss of bone around teeth and gums receding.
That's irreversible.
And that's irreversible. And then that sets them up for plaque and tartar building up more quickly, so it becomes a vicious cycle that eventually they lose teeth.
All right, I'm going to put Dr. Williams on the spot. Do you brush Jillian's teeth every day?
No, I do not.
See, so it don't feel bad. I said the same thing. I thought, because that's a tall order, really, in our busy lives, to brush our dog's teeth every day.
It's the key is to start when they're a puppy, when they're very young. Right. You get in the habit, they get in the habit of accepting it. Right. That's the key to doing it. To start at this age to do it, I make it a little more resistance.
Right.
But starting early is the key.
But that makes a lot of sense. If you start when they're a puppy, that's just part of life for them, and so they'll do that. So we have an after picture.
Right.
A before and an after picture. So, Suzanne, let's see if we can put those up. So, all right, talk about these.
The before picture's on the left. You can see that plaque and tartar and kind of staining back on the back teeth. And then the other picture on the right is after we've cleaned. There's a close-up. You see the tartar staining, a little bit of redness above that. That's gingivitis.
Does that hurt them when they feel like that?
No,
they don't know?
No.
Okay, so this is the after.
And then afterwards, the teeth are nice and clean and white. And if we were to take another picture in 3 or 4 days, that red inflammation back there would be gone.
Often I think we look only for plaque rather than the redness of the gums. And it is as important to deal with dental work if the gums are red as if you see the plaque. Is it not, Doctor?
Correct. Yeah, the reaction is to the plaque that you really don't see. That's tartar that we're seeing, and that is not what the dog is reacting to. It's the plaque that's right up underneath the gum line that causes that redness and inflammation.
Okay, so I guess the kind of the takeaway from our conversation today is, if you don't already do it, try to start brushing your dog's teeth. Do you recommend a professional cleaning from someone, or can you just do it yourself?
They have to be put under anesthesia to properly clean the teeth.
But that's if it's advanced, right?
Right. The first step would be see your veterinarian. This is Pet Dental Month. February is Pet Dental Health Month. Great opportunity to see your pet's veterinarian, have them look at the teeth and discuss whether dentistry is needed at that point, or whether you can do home care and work on teaching the dog or the cat to let you brush the teeth, and puts off needing to clean the teeth. If this dog gets home care, we're going to be able to put another 2 years between cleanings.
Excuse me. Okay. All right. Well, Dr. Gaddis, Dr. Williams, good to see you. Jillian, good to see you too. She's going to go brush her teeth now.
Absolutely.
She says so much.
For only 30 or 60 seconds is all it takes.
That's all it takes to brush their teeth.
And you can train them to bring the toothbrush to you.
That would be a trick. All right. We'll take a break. We'll be right back. Checking in with JJ.
All right, Jan.